Well, hello, everybody, and thank you guys so much again for having me speak for CC Animal Health. Hope everybody out there is healthy and staying safe. It's kind of, again, interesting times and kind of a mixed emotion kind of day hearing about, unfortunately, so many people still experiencing illness and hospitalizations with COVID. But yet today, the first Pfizer vaccine was given to someone, a 90-year-old woman from Cardiff, Wales. So that's pretty cool that she stepped up and has been the first one to receive a vaccine. In the first group, they also had, I guess, the second person that got it, believe it or not, was named William Shakespeare. And he says he's 81 years old. I'm calling him out on that. I think the dude's a lot older from what I can remember. Bill Shakespeare should be well over 100 years old by now. All right, well, guys, we're going to go ahead and talk about some non-traditional, maybe, approaches to osteoarthritis in dogs and cats. The title is Not Everyone Gets Enough Said, or Not Everyone Gets an NSAID. We'll define what NSAIDs are for you then in just a couple of minutes. Again, I'm Dr. Oswald. I do have a couple of financial disclosures. I do some consulting for CC Animal Health, our sponsor today, as well as a couple other veterinary companies. All presentations have to start with something with cats, at least is what my cats at home tell me. So here's the most interesting cat in the world. He doesn't always fall, but of course, when he does, he lands on his feet. So let's talk a little bit then about osteoarthritis. So you guys don't really need to know a lot about the causes of it, but obviously it's a disruption of usually the long bone articular joints of the body. So in people, we think about shoulders and elbows and wrists and knees and hips, and the same thing in dogs and cats. They experience the same type of degenerative diseases, either because of age alone, or in some case, maybe they've had trauma to an individual joint at some times throughout their life. But that loss of normal bone and cartilage integrity leads to a progressive inflamed joint, a painful joint, and then obviously clinical signs that are difficult on quality of life. I think the important take home from here is that osteoarthritis affects probably over 80% of our dogs and cats when they reach what we would consider geriatric age. So it's something we see very, very commonly, both as owners and of course as veterinarians. So what's important for you as owners is what are the signs you're looking to see? And I want to bring your attention to, it's not just as simple as a pet who's lame or off on a leg. I mean, a lot of them have a significant drop in their activity levels because it hurts to do things. They sleep more, they rest more, they sleep in places that are easier to get to than maybe what they used to do. They just don't interact with people in the home or other animals the way that they used to. So again, quality of life issues. They obviously have reduced mobility. There may be an obvious lameness. It may just be more of an overall generalized stiffness, or maybe a reluctance, hesitancy, difficulty in getting up and down or jumping up and down on things, dogs on furniture, cats in windowsills. If you have stairs in your home, many times it's a more difficult proposition for them to get up and down stairs. Cats specifically, more difficulty getting into litter boxes, especially with high lips. And dogs sometimes have a lot of difficulty positioning themselves to urinate or defecate because they have to put more pressure either on one leg or both back legs when they go. You also might notice some other things, again, that altered grooming, where you just don't see as much, especially in cats. Their hair coat becomes more rough and discombobulated from not grooming as much. Maybe especially around joints where it might hurt. Cats oftentimes get overgrown claws because they don't groom properly, and those become more of, again, a mobility impairment. And then as you see grumpy cat and grumpy dog up here, they just have temperament changes. They're just not themselves. They're irritable. They're grumpy. They don't seek interactions with us like they used to. And again, all of these things, beyond just being difficult and getting around, are definitely quality of life issues that we don't want to see anyone, especially our pets, going through on a day-to-day basis. So, when you come into the veterinarian's office and you're told or you're suspected that your pet has osteoarthritis, veterinarians, we're wonderful people. We really want to be out there and helping animals and do the best we can to improve quality of life. But just like anything else, we become complacent at times. Our time with you as a client is oftentimes limited by the appointment schedule. And what we seek to do is try to provide initial comfort. We try to make a patient feel better. And I think our knee-jerk, if you will, reaction as doctors is oftentimes to give drugs that we're familiar with, that we know will have an immediate effect. And those tend to be drugs that reduce joint inflammation or pain, oftentimes called NSAIDs, non-steroidal anti-inflammatory drugs, drugs like ones you've heard of, Duramax, Rimadyl, Metacam. And there's all kinds of now variations of these drugs, as well as generic formulations. Oftentimes we as veterinarians and you as clients don't ask the important questions in that short time we have together in the exam room. We don't ask questions about, are there other things that we could be doing? Are these drugs meant to be given long term, or just should I use them as needed? Are there things that maybe could complement these type of drugs and not make us as reliant on drug therapies? And again, that's simply a fact of what happens in medicine. And I would encourage all of you after today's talk to be more proactive when you talk to your veterinarians about arthritis and what the goals are in drugs you use, because there's a lot of other things out there. We tend to oftentimes look at other things like condoprotectants. We'll talk about those, nutraceuticals, some ancillary treatments and devices we'll talk about today. And then some really important things like optimizing body condition. Nobody as a veterinarian likes to tell people their animals are overweight, but a huge percentage of our geriatric animals are. And simple weight loss and becoming more active makes a huge difference. I can just give you my own example. I've got a bad knee from a baseball injury. And I was pretty certain in this last couple of years I'd be getting a knee replacement. I've got pretty end-stage osteoarthritis. I took a steroid injection. I took some joint replacement fluid injections, and they did certain things. They made me better for a little while, but it wasn't until I got more active, I lost some weight. I actually did start doing pulsed electromagnetic therapy on that knee, and now it's probably the best it's been in a decade. So again, I think we have to not be totally reliant on drugs. Why not? Because as we get older patients have older organs. We all know that. And aging is a process that we will find that over time we get diminished ability for organs like kidneys, liver, the cardiovascular system to do their jobs. And certain drugs can, in patients that have impairment of those systems, start to create some problems. And we certainly don't want to do harm. That's one of the biggest things we don't want to do to any patient, especially older dogs or cats. Cats are a whole different story when it comes to how we treat them. Many cats have osteoarthritis. If you watch your older cat get around and how they jump up and where they go, you start to get a feeling that, yeah, they are more limited than what they were as a younger, kitten and patient. But we have other problems with cats when it comes to treatment in general. They're hard to give oral medication to. They oftentimes, when they take multiple drugs, it has a dramatic effect on their behavior, their interaction with us. They don't like us when we give them lots of things, and their appetite. Cats have unique abilities in how they deal with drugs, and sometimes side effects and issues are more prominent in that species. And many geriatric cats develop kidney disease. I mean, we know that almost 80% get arthritis, 80% get kidney disease as well. So we have to be very careful with drug therapies. So just a real brief mention again of these things like NSAIDs that you guys know that are probably the biggest number one prescribed treatment for arthritis. There are multiple drugs that provide anti-inflammation in the joints themselves. And if you lessen inflammation, you'll lessen pain, increase mobility. You'll have a patient that feels better and can use that joint better. We never want to use glucocorticoids. Those are drugs that you've heard of like prednisone, prednisolone, dexamethasone. Those type of drugs, steroids, when they're given long-term, actually will exacerbate joint damage. So no veterinarian hopefully is going to use those. But non-steroidal anti-inflammatories, these NSAIDs, like Rimadyl or carprofen, the generic name, they do a lot of things that, again, make your joints feel better by lessening inflammation and then directly lessening pain. But they really don't do a lot to protect the joint. And again, these are the drugs that have the possibility, especially in older patients, of creating issues with organs. So our goal really should be to use the lowest effective dose and only give these drugs when they're needed for significant impairment. And I think a lot of times with veterinarians, that gets lost in our conversation with you guys as owners. As an internist, I see patients that have kidney disease, liver disease, heart and lung diseases as they get older. It's amazing to me how many of them are on these type of drugs consistently. And not to say that these drugs are creating any problems, but they could. And again, if we can use NSAID type drugs, these anti-inflammatories less often, or complement them with other therapies, I think our patients are going to do better. There's some new information out that we used to think that these drugs shouldn't be given to any cats. If you are a cat owner, the good news is you can use NSAIDs in cats, but the principles are still going to be the same. You should really be looking to use those drugs when the patient is symptomatic and hopefully not relying on those all the time. So what else do you have? What else can we use to maybe decrease the reliance? These are the things you need to ask your veterinarian about. So the first thing everybody would say is, hey, let's protect the osteoarthritic joint. Let's use a chondroprotective. We've all heard those names, glucosamine, chondroitin. And while those type of supplements can have benefits early in arthritis, by the time you have significant arthritis, like you see in this patient's knee model here, these drugs have limited ability, or these supplements have limited ability to really provide much help. So again, it's so common for us to give NSAIDs, and then when things get worse, to give chondroprotectants like glycosamine glycans. Again, I think at that point in time, the boat has already sailed. Most of these patients are not going to get any significant improvement if they're symptomatic. Again, these are things that should be used early. They won't hurt, but they're probably not going to give you much help. And it's just one more thing you have to, get down your animal's throat every day. So I'm not a real big proponent in especially symptomatic arthritis of using chondroprotectants. So what would I recommend to you guys? What should you talk to your veterinarian about, or intuitively just know you should do in your own home to help patients with arthritis? Number one, look at the environment. Here's some pictures here where maybe this is not a good idea to have your cat climbing up this tricky stairwell you've built to get to the food and water bowls. Maybe we shouldn't be using high-lipped litter boxes. If you have a lot of stairs in your home, using things like ramps. Here's a great example of these Yorkies being able to get up on the bed easier. Low lip entry litter boxes, heated pads and beds for animals to lie in when they're sleeping. We all know that heat makes your joints feel better and more mobile. But anything we can do to encourage these patients to be able to get around the house easier with less stress, on those joints. Number two, I already mentioned weight loss. It's easy and it's cheap. Now, it's hard to discuss. Again, a lot of times it's a discussion that veterinarians don't like to have with owners, but honestly, we should, because we all want the same thing for our pets, and that's to feel better and do better. And a leaner, meaner body is going to have a lot better tolerance of osteoarthritis. So getting your pet on a diet and documenting that you get consistent weight loss over time, weigh them, get them out for more walks. If you're a cat, get that laser beam out or toys on a stick to play and encourage activity within the home. So many cats don't get much activity. If you're a dog, get out there more and walk longer. If you live in a place like I do in Florida with a pool, get that dog in the pool. Let them burn some calories those ways. You'd be amazed, though, at just, again, how much weight loss improves osteoarthritis and takes the reliance off of some of these drugs. If you're severely affected with osteoarthritis, getting out and taking it to the next step, even talking to your doctors about physical therapy, either at their office. There are now multiple physical rehabilitation and therapy sites for animals around most major metropolitan areas with board certified, rehabilitation specialists. There's a lot of things you can be doing at home for joint, range of motion activities. And anything you do that makes things more active strengthens muscles, strengthens these around the joint or periarticular tissues, supports these affected joints better, and you will see improvement. Doing things like, again, underwater treadmills, like you see this dog here, or I think this is a video. You could even do a little manual massage. Yeah, look at this cat. I have an orange male cat at home, looks just like him. You tell me he's not enjoying that. If he's got a stiff neck or stiff shoulders, he has come to the right spot. So again, lots of things you can do that don't rely on drugs to help patients do better, and they're done at home many times where the animals are appreciative of that. Medical assist devices, things that improve traction, especially as snowy weather hits in areas of the country. We don't want animals that are older slipping and sliding on ice just like we don't. Anything we can do to reduce weight-bearing stress. So these little belly support systems to help animals get up and down the stairs. Obviously, if they're smaller, you can pick them up and walk up and down those stairs. Stability splints, compression splints, just like all the things you would see in people. If you have a specific joint that needs to be supported, many animals will tolerate these sort of medical assist devices, and they're wonderful things. Nutraceuticals. So nutraceuticals are other natural substances. So we're not going to talk about glucosamine chondroitin. We said we don't think that works that well in patients that are symptomatic. But there's other nutraceuticals that both reduce joint inflammation and pain. So they're similar to NSAIDs in that they do some of the same activities, but through a much more natural process. So these are things like omega-3 fatty acids, which can be found both in many foods that are prescription foods for osteoarthritic patients. They can be found as over-the-counter supplements. Green lip mussel extracts provide a lot of omega-3 fatty acids. A product called microlactin is something that also reduces inflammation through a different mechanism, and what are called undenatured type 2 collagens. I won't spend a lot of time on these, but these are things you should ask your veterinarian if the food you're feeding maybe contain them. If not, feeding a supplemented food is not a bad idea for an arthritic patient. But also, again, getting these products where you can get them through your veterinary office or via the internet. I would always recommend you get ones made for animals specifically, not generally going to your drugstore for people. Again, there's plenty of green lip mussel extracts that come both in treats and in tablet forms. Microlactin, again, is a concentrated milk protein from cows that reduces inflammation in joints. People have taken it in Europe for years and done very well with it. It does come in a veterinary form, duralactin, that can be obtained either through your veterinarian or again through internet sites. And again, this undenatured type 2 collagen has a different mechanism of reducing joint inflammation. All things you should put down in your notes, think about, ask your veterinarians about those products. Now, what about some other non-traditional things that again would be possibly able to decrease your reliance on drugs and maybe used with here and there intermittent NSAIDs on days your dog or cat is showing symptoms? Maybe taking one of those nutraceuticals, fish oil, duralactin, something of that nature every day as a supplement, and then adding something like these types of additional non-drug therapies might significantly help arthritic patients. And here's one you can do at home. And the more you can do at home, I think the better for the patient and the better for you. So pulsed electronomagnetic field therapy, which is our sponsor, the CC Animal Health today, is one of the innovators of this in the veterinary field. Using these pulsed electromagnetic fields placed over affected tissues that are painful and inflamed can basically change the way certain metabolism is performed at the level of these tissues. You end up with more nitrous oxide in tissues, and that helps in reducing inflammation, modulating pain, helping tissues possibly grow and repair. Again, these things have been looked at in the human field for over 100 years, over a century now. And there's numerous anecdotal case reports and experimental evidence in the human field that tells us that there can be a benefit to this. Now, none of these types of devices will work for every patient, but you have to figure out patients that they work for. And I'm a believer because I use it. And I can see a significant change in my knee since I've been on this over the last 12 to 14 months. As far as animals go, it's at home, which is wonderful. It's drug-free, so you don't have to worry about any side effects. There's no invasiveness to this procedure. Matter of fact, most animals don't even know that you're doing it to them, which is wonderful. No reported adverse effects. Again, it can be used in combination with any of the other osteoarthritic treatments we're talking about today. And you can target it to individual joints. I'll show you that in a second, that are bothering the patient. Maybe if the knee or a shoulder is where the pain is emanating from most days, you can target that area. There are starting to be some studies in veterinary medicine that are actually looking at this from an evidence-based modality. A nice study just came out last year looking at it in spinal conditions, showing that use of pulsed electromagnetic field therapy can reduce pain and get patients off of narcotics much quicker. So CC Animal Health, again, our sponsor today, makes an interesting product called the Loop. And if we go back a couple of slides, let's see if I can do that easily for you. You see the loop here in the middle of my picture, and you can see the electromagnetic field emanating out of it in a circular fashion. So again, if you can put the affected joint or area of the body into this field, you're going to get the benefits of this therapy. And so looking at the loop, you can put it over joints. Here's a good application over the elbow area. Here's a patient, you could put it in a little vest that can come with these products over certain spinal areas and help in that condition. Here's a cat with hip arthritis. Again, many cats will sit comfortably being petted and allow you to do a 15-minute therapy with a product like this Loop. And I think this is really cool, is you can actually get a bed for your cat. And at least my cats love to sleep in cushy beds. And these Loops, you can actually back-to-back them within there, and can cover almost the majority of the body for this cat because they're small animals. And obviously you could do the same for dogs. Being able to treat the entire body if your arthritis is generalized, where you're real stiff and sore all the time. So I like pulsed electromagnetic therapy. I think it's a wonderful thing. And again, I thank CC for being active in that field. Other non-traditional things that you can do, we can try to block pain directly. This doesn't do a lot to mitigate inflammation, but using acupuncture. Now, obviously, you're not going to do acupuncture at home. So it is going to be an outpatient therapy where you'll have to travel to either your veterinarian's office or someone they refer you to that does this sort of traditional Chinese therapy, but it is drug-free. It's minimally invasive. These little needles, I've had them done to myself, really are not painful, and most animals are not bothered whatsoever by the placement of them. Really no adverse effects to worry about. And again, you can use acupuncture in addition to any of the other therapies we mentioned so far today. Cold laser therapy is another thing that has become somewhat popular in veterinary medicine. I don't know how popular it is currently in human medicine anymore. Honestly, I've been a little disappointed in at least the clinical effects I've seen in patients I've referred to the pain management specialist in our practice. But cold laser therapy does some of the same things in principle that electromagnetic field therapy does, and it changes things in the tissues that are exposed here to photons from the laser. And again, it's supposed to help with the same reduction in pain, helps with tissue restoration and healing. Again, though, my feeling over the last decade to two now that it's been introduced in veterinary medicine is personally, I haven't seen as much improvement with it. And again, it does have to be done by a professional where you're going to go and have repeated treatments. So there's, travel several times a week, oftentimes, to keep up with these osteoarthritic treatments. Again, it may help your individual dog or cat, though. I don't want to poo-poo it. Again, every one of these therapies has to be looked upon as individuals. A couple other things, if you have just one bad joint, maybe you had knee surgery earlier in life in your Labrador, then using things like stem cell therapy or platelet-rich plasma injections into the joints possibly, again, have some role in improving those joints and lessening your reliance on drug therapies. So certainly something that is beginning to be done more and more in our field. I don't know that we really have enough information right now to say that it's better or worse than any of the other therapies. It's, again, an individual trial to see if it helps your patient. Cannabinoids. I have no idea what to tell you guys about it. There's still some legality issues, although after the last set of elections, it's probably less and less in the US. But more importantly than legal issues, we want to know, is it effective? And honestly, the studies are just starting to be done. We have very little good experimental evidence as to what CBD type oils and things do for animals. We just have to rely on looking at them to tell whether we think they are more comfortable. Many people feel they are. There doesn't seem to be a lot of side effects with them. But again, I would certainly consult with your health professional about their opinion and whether they think that using cannabinoids can be of help to you. Now, in patients that are significantly impacted with arthritis, where maybe you have been on NSAIDs and maybe you have tried the loop or you've tried acupuncture, you're using those things routinely, yet this patient's still painful. You can see meow. Well, there's an owl in there. There are some additional drugs that you can speak to your veterinarian, or your veterinarian should probably speak to you about. Non-narcotic drugs, you may have heard of gabapentin or amantadine, that these are drugs that specifically block pain responses at the spinal cord level. So they don't do anything for the joint itself, but they're just trying to mitigate pain. They can be a wonderful as needed or continuous addition to patients that are hurting. You also have some narcotic drugs. I'll call your attention to tramadol first. Tramadol is a drug we've now used for well over a decade plus in veterinary medicine. And the bad news is it gets prescribed all the time in dogs for arthritic pain. And the more we know about this drug, the less likely it is that dogs really get that relief we think they do. So don't be surprised if your veterinarian prescribes tramadol to your dog and you don't see a big improvement. That's not uncommon. It does work in cats better, but they absolutely hate the taste of this drug no matter how you prepare it. And it makes it difficult to use in that species. So I've gotten away from tramadol as a routine use. Again, I might try it in a patient with severe arthritic signs that are maybe not as responsive to NSAIDs and the other therapies we've talked about as a multimodal approach. Narcotic drugs are a last source of consideration for you. Narcotics are difficult not only for people. We all know the problems we've run into with narcotic use in humans, but the bottom line is many of them just making animals sedate, less active, they don't eat as well, they get constipated. And again, rarely do we improve quality of life with long-term narcotics in dogs and cats. Buprenorphine is one that can be given in the mouth through a syringe you see here. It could also be injected as well, but it is one that can be used in both dogs and cats that again, maybe need it for breakthrough pain, where they've been doing pretty well on their loop and maybe their acupuncture treatment and their NSAID. But now they get a little breakthrough pain for a couple of days, then using short-term narcotics certainly would be a consideration. But be careful. You really don't want your pets on long-term continuous narcotics. And again, just a word of caution, tramadol, which is again a narcotic-like controlled drug, just doesn't seem to be very effective for dogs or cats. So guys, in summary today, what am I trying to get across to you? Don't rely simply on one class of drugs, NSAIDs. Again, just like you, if you have arthritis, you need to look at a multimodal lifestyle changing approach to make yourself comfortable. That should include weight loss if you're overweight. It's got to include maintaining moderate activity. Resting joints is not a good idea in chronic arthritis. You need to get on that bicycle. You need to take your walks. And your dogs and cats need to become active in some manner as well to move that joint, distribute that fluid for them to feel better. Choose multimodal complementary therapies. So again, if NSAIDs help, let's find out what else helps. Let's not just rely on them every day. Let's look at pulsed electromagnetic field therapy. Let's look at acupuncture, consider cold laser therapy, and all of those things. Consider your nutraceuticals, your fish oils, your microlactins, that again, none of these things have serious side effects in older patients and many times can reduce that reliance on drugs. Start treatment early with arthritis and then escalate your therapies as needed. And lastly, just be careful in cats. You see our cat down here, he says no. Cats, again, are not very appreciative many times of polypharmacy. They just don't like taking a lot of different things. So things that can be done to them in the comfort of their own home, like massage, like a heated bed. Again, lifestyle changes to get them around the home more comfortably, lower litter box lids. And then especially for me, the loop, again, my cat, I have an older 17-year-old cat now that uses it on a fairly routine basis, and it seems to help him get around better. and he doesn't even know I'm doing it to him, which is really a nice complimentary way to treat somebody in a cat when they don't even know they're being treated. Okay, so last thing, guys, this is Stella. This is our goal. We take a dog like this who we hope if they have arthritis, we start doing these multimodal things, lose some weight, get lean and mean, and here she comes. Dog named Stella. You cannot have arthritis if you're this dog, because she lives for one thing, and that's good fall weather. And all she cares about is leaves staring at me, Stella staring at leaves, go. What a great pup. All right, I want to thank CC Animal Health again for sponsoring today's session. Thank you, Nicole, if you're still out there. And happy to always do these for you guys. It's always a pleasure. And I hope for our pet owners out there today, you've learned to ask the right questions and think that there's a lot more out there than just NSAIDs.